Hello, I'm Dr. David Polly, and I would like to welcome you to the University of Minnesota Combined Orthopedic Surgery and Neurosurgical Spine Fellowship. So I do both adult and pediatric spine surgery. About 60 to 70% of my practice is deformity, pediatric and adult, and that I do a lot of revision work as well. Another component of my practice is problems around the sacroiliac joint and pelvis, whether they be degenerative or traumatic. So our program currently exists at the University of Minnesota Medical Center. The University of Minnesota Medical Center has two campuses, an East Bank and a West Bank. Most of our work is done on the West Bank, or sometimes called the Riverside campus. That is co-located with the University of Minnesota Medical Center Children's Hospital, and that we have both our adult and pediatric patients in general in the same facility. Sometimes we operate on our East Bank or main university campus when medical conditions require that they have special facilities available. In addition, our clinical outpatient practice is at our Clinics and Surgery Center, a very new building which was just recently built and has a lot of capacity in terms of imaging, including EOS, advanced CT, and MR imaging. In addition, I also do clinic at the Shriners Hospital. That allows us to see the complex needs pediatric patients, and if surgery is needed, then that's done at our University Children's Hospital. I think what sets this fellowship apart is that we don't view the fellows as a source of work or work effort, that what we're really trying to do is train the next generation of high quality thinking and doing spine surgeon leaders for the country and the world. Currently, we're blessed to have significant technology in our operating rooms. We were one of the earliest sites utilizing intraoperative cone beam CT, O-arm, and navigation. We've been using that since 2006 and are probably one of the leading sites in the world in terms of experience and efficiency. Recently, we obtained a surgical robot, and we're in our early part of using that technology as well. We are the first facility in the world to have intraoperative 2D long film capabilities as part of the O-arm, and so we've been helping to lead the development and utilization of that particular technology. Past fellows have been very productive in terms of research. I think fellows can generate as much research output as they desire, but it is expected that at least one significant project will be accomplished during this time window. We don't expect fellows to do this in a vacuum. We have a dedicated research team that is actively involved as well. We're participants in the American Spine Registry, several AO spine research projects, as well as industry-funded studies. So we have a lot of ongoing activity, and I think that there will be a menu of opportunities for the fellows to choose which projects they find most appealing to them. So as the leader of the spine group, what I will tell you that I have looked for in my partners is folks who are team players. And specifically, I like the phrase of the three musketeers. We're sort of all for one and one for all. So our concept of how we want to get things done is if someone has a high workload and we can help them out, we do that. All of us are academically curious. All of us want to help our partners. All of us want to help patients get the best outcomes that we can. And it's not unusual for us to have someone say, well, hey, listen, I need help covering something. Can you do that? And we figure out amongst ourselves how to make it work.
Hi, my name is Jonathan Sombrano. I'm one of the spine surgeons here at the Department of Orthopedic Surgery at the University of Minnesota. And I have been here since 2008, so 13 years now. And my practice is now 100% spine. And it is cervical, thoracic, lumbar, both open, minimally invasive, pediatric, and adult. So I pretty much do everything. We also, do a number of sacroiliac joint fusions, as we are, I think, the only practice here in the cities that offer that surgery. We've been using navigation since I started training. So what would be the benefit of doing your fellowship here with us at the University of Minnesota? That's a question, obviously, that any prospective fellowship applicant would ask. I could tell you that, first of all, the breadth of cases is very wide. You get to see everything, a lot of revisions, a lot of deformity, a lot of degenerative conditions, but you also get to see pediatric deformity, and you get to see everything, cervical, thoracic, lumbar, and including the sacrum and the sacroiliac joint. You'll also get to see different ways of treating it, both minimally invasive and open surgeries. And then the faculty, I think it is very, very good. Yeah, Dr. David Pauly is a very world-renowned past president of the SRS, and a very knowledgeable, very smart, very skilled individual. And then my other partners, Dr. Christopher Martin, very, very skilled surgeon. He's only, I think, 4 years out of practice, but he is already very good. It's kind of scary to imagine how much better he'll become. And then Dr. Nate Henderson just recently joined us this month, coming in very highly trained. And so we are very excited to see him grow and do great things. Dr. Kristen Jones, who is neurosurgery trained, but did her fellowship with Dr. Pauly. So she has both orthopedic and neurosurgical training, and kind of has the best of both worlds, so to speak. So coming in very highly trained as well. My background's a little different. I did most of my medical school and residency training in the Philippines, but I also did fellowships in spine surgery, pediatric orthopedics, and even joint replacement. So I think those experiences, all those experiences, give me a little bit different perspective and something to bring into the table as well. So all of us are very busy, full-time spine surgeons, and all of us are committed to educating not only the residents, but now also the fellow. And so we're very, very excited to start our spine fellowship program.
Hi, I'm Christopher Martin. I'm one of the spine surgeons on faculty here at the University of Minnesota in the Department of Orthopedics. I went to med school at Johns Hopkins University, and my residency was at the University of Iowa. I followed that with fellowship at Emory, which is in Atlanta, for spine surgery. And after that, I joined the faculty here. So I'm entering my 5th year in practice with the group. My practice is about 60% degenerative conditions spread across cervical, thoracic, and lumbar, and about 20 to 30% deformity, again spread across all of the anatomic regions, with a special interest in cervical deformity. Then there's about 10 to 20% other, consisting of infections, tumor, trauma, and some rare pathologies. The Spine Fellowship at the University of Minnesota offers a very robust experience with exposure to cases in both the cervical, thoracic, as well as lumbar regions. The case complexity tends to be high, reflective of a university and tertiary care center, and there's a high percentage of deformity cases. But in addition to that, there are a very large number of bread and butter cases. My own practice is about 30 to 40% degenerative spine, and we do a large number of T-lifts, X-lifts, O-lifts, and A-lifts, so there are a variety of approaches. And I think that anyone that comes through training here will be exposed not only to a wide variety of pathology, but a number of approaches for treating that pathology, and come out of it with a very substantial and significant skill set. Our university practice has a robust research mission that is well supported with ancillary faculty and staff, including research assistants and assistants that help with both the IRBs as well as the running of the projects themselves. And with that, we've been able to be very productive. Some recent examples of research efforts have included a multi-center study on acute catastrophic pelvic fixation failure, which I was the lead author on, and which won the NASA Award for Best Paper of the Year in 2021. Other areas of focus have been around deformity in image-guided surgery, as well as in some industry-sponsored trials regarding new devices and new bone graft materials.
Hi, my name is Kristen Jones, and I'm one of the spine surgeons here at the University of Minnesota. I am a neurosurgeon by training, and I am a faculty member of both the departments of neurosurgery and orthopedic surgery here. My practice is predominantly spinal deformity, probably about 85% deformity, which is unique, but that's what I wanted. So that's a practice that, along with my orthopedic partners, I have built over time, and I feel very fortunate to have that. I do some degenerative cases. They're usually more complex degenerative cases if I do get them, and a smattering of things like tumor or trauma transferred from other institutions as well. One of my favorite parts about my job is the people that I work with, and no one's paying me to say that. I really genuinely enjoy my partners as well as the other providers that we work with in spine. I think that each operating day generally brings a significant challenge as far as the difficulty of the case, but one thing that I know is always the same is the support that I have around me, whether it's my partners who I genuinely enjoy being around and who are actually really good people as well as excellent surgeons, as well as our supporting APPs and nurses and clinic staff, our imaging squad, our OR techs, our OR nurses, everyone that's working with us. We have over time really accrued a great group of people who all seem to enjoy working with each other, which is really unique in my experience. And it's something that I think makes our practice, while it's always very challenging with the difficulty of cases that we are taking care of, I think it makes our practice really rewarding. One of the goals that we had in creating our fellowship was to create a well-rounded experience for the fellow, but also to foster the individual interests of the fellow. And I think that's a real strength of this program. I can speak personally to that because I was the first fellow in this particular program format 7 years ago now. And it was an incredible experience that was really centered on what my goals for my academic career were. And I'm really, really grateful that I had the mentorship and support that I did. And I think that it's something that each of us is very interested in continuing for our fellows, is to support whatever your individual interests are and to help you find out what that is if you haven't quite decided on what area of spine is your niche, or if you want to do general, or if you want to do academic, or if you want to do private practice. I think we are very aware that all different kinds of careers are mixed in, and we'll try to help you find what your exact ideal area is.
Hello, I'm Nate Henderson. I'm one of the new surgeons here on staff at the University of Minnesota. I trained residency at the University of Iowa and then a fellowship at the University of Utah, primarily open surgery. My practice is going to likely evolve to start seeing a good portion of the deformity and complex revision patients that Dr. Pauly takes care of every day. He has a very, very complex practice. With that, I also have a outreach clinic in Blaine where I will likely have more kind of primary degenerative conditions, less complex patients, which will be a nice break from time to time. Really excited to join their group. It's a great group of outstanding mentors, an incredibly supportive environment here in the department. So I'm most excited to start working with fellows and people excited about working in spine surgery. I think there is a lot going on right now in spine surgery, and a lot of it has to do with how are we going to use these enabling technologies to better enable us to achieve our goals for surgery, whether it's that same planning or using different types of engineering, artificial intelligence and machine learning to identify our kind of goals for surgical correction. And then how can we use enabling technologies such as navigation, robotics, even pre-contouring or one-of type of constructs to really dial in the corrections that we want while hopefully minimizing the big complications associated with deformity surgery. I think the technology that is coming is something that can help us be a little bit better, maybe sometimes a lot better. It's not something that we can't make it a crutch. So I do think we have to learn to do surgery the anatomic way in case technology fails, or you just have to have that experience, but also being able to get exposure to those different techniques, different technologies that help us. We have a wide breadth of experience on our team, from open, complex deformity and revision surgery to MIS approaches like MIS T-lifts, single position lateral, minimally invasive, robot assisted surgery. And we're hoping to bring in or to add to that some endoscopic assisted techniques in the next few months that will just further help us identify if these are ways that we can decrease the overall surgical stress on patients. I think there's a lot of great opportunities, and it'd be a great place to see all these techniques as a fellow.
So thanks for taking the time to look at our website and view these video clips. We hope that you'll apply to our program and that we would be happy to train you in the future going forward. It's a great opportunity, and it's going to be fun for whoever it is that chooses to come here and that we're able to work with. Have a great day.